Bangladesh has always faced challenges for the provision of safe drinking water. A few decades ago, shallow groundwater tube wells were introduced. Eventually, they provided water to 97% of the population. In the mid-90s, however, naturally occurring arsenic was discovered in the groundwater. This puts at risk up to 60% of the population. The crisis has been described as the largest mass poisoning of a population in history. Since 2005, a team of researchers, practitioners and medical doctors, the Arsenic Mitigation and Research Foundation, has been working on the implementation of community-based safe drinking water supplies and on the treatment of patients suffering from arsenic poisoning. To support this work, AMRF has recently established a community clinic.
Many of the patients does not have any symptom, but they have got those pathological changes due to arsenicosis. So when we send our paramedics from village to village to look for the arsenicosis patient, we only screen out those who have got some symptoms, signs and symptoms of the body only. So that part is not very much diagnostic. For initial screening, we send this patient to the satellite centers. The satellite center means the medical health provider at paramedics level, they go once or twice a week. There they have got the expertise. They can diagnose. The satellite centers actually screen which patients should at this moment need to go to the static center and those who don't need. Okay, initially they start treating there, and when they find that it's difficult, it needs further investigation and treatment, they send to this static center. The static center is the permanent center, which you can see in the background. This is the static center. Medical gadgets are there. We have got to some extent, some investigations. We can do some pathological tests. You cannot only treat the symptoms of or signs of the arsenicosis, because they're suffering, they've got other problem too. And if you treat that only the symptom of arsenic, the patient gets, okay, look, I'm not getting well because you are giving some medicine and I don't find myself feeling well. I've got this problem, I've got that problem. Sometimes you need further investigation and we need further treatment because we don't have all the facilities in static centers. So some of the patients we have to send to Dhaka, that is around 40 kilometers away from the static center. We are working with another organization who has got a tertiary level care hospital. So we have got a good understanding with them. So we do this treatment at a very low cost from them.
Those most severely affected by the poisoning are also the poorest. To ensure their access to treatment, we have to ensure medicine, investigations, sometimes surgery, and transportation between the villages, the satellite centers, the community clinic and the hospital in Dhaka.